Hello guys, welcome back to my channel Ages Kingdom. Hereafter I would like to give some important one word answers like vital signs and the commonly used terminologies in the hospital setup, which is used even for NORCET also, and even it is helpful for day-to-day learning. Let's start. And today I would like to start the topic from pulse. What is pulse? So when you are in the hospital, just the first thing, if the person is alive or dead, the first thing what we do is checking the pulse. What is pulse? A pulse is an index of heart rate. If pulse is existing, that means heart is working, and heart rate we can analyze. It's an index of heart rate and rhythm. Pulse provides a valuable data about the person's cardiovascular status, how the heart is working, and is there any variations. You can find out just with the pulse, and it is a very major, important, vital sign for analyzing the person whether live or dead. The pulse is a wave of blood created by contraction of the left ventricle of the heart. The pulse is a wave where the blood is created by contraction of the left ventricle of the heart. So, how many times the left ventricle of the heart is contracting, that many times the heartbeat can be felt. Let's call it as a pulse. So, let's see. The is the rate of the heartbeats. A pulse is actually called as a heart rate, which is the number of the time heartbeats each minute. In sometimes cardiovascular diseases, the heartbeat or the pulse rate can be differ. So this is the condition, and why we have to check the pulse means to establish baseline data for doing any kind of treatment or any kind of medications advice. This is the major indicator for analyzing any kind of disease conditions, and to identify whether the pulse rate is within the normal range or not, to determine whether the pulse rhythm is regular and the pulse volume is appropriate or not. So determine the equality of the corresponding peripheral pulses and each side of the body. That's the purpose of the heart. And if you see the normal pulse rate, the babies under 1 year, approximately it comes with 100 to 160 beats per minute. And 1 to 10 years, it comes around 70 to 120 beats per minute. For normal adult, it ranges maybe between 60 to 100 and normal adults. So average normal pulse rate range is from 72 to 82 beats per minute for normal adults. So here they are saying like greater than 10 years to adults, it is approximately 60 to 100. And for athletes, maybe it can be 40 to 60 also. 40 to 60 also. This is about pulse. It is a contraction of the heart, and it is the baseline for identifying whether the patient is dead or alive. So we have to find out whether baby's age according to that pulse rate. We have to understand below 1 year it is approximately 100 to 160 beats per minute will be there, and for normal average adult it is 72 to 82 pulse beats per minute, and if it is a normal average we can see 60 to 100 beats per minute. Thank you for watching. Subscribe.